Hello everyone, this is another class for mental health. We want to talk about schizophrenia. Schizophrenia is a psychiatric syndrome characterized by a split in personality. It is one of the major psychiatric disorders. We have also types of schizophrenia. Number one, we have schizoid simplex. Features of this include social deprivation. Example, psychopaths. Early irritable. Example, drunkenness. Prostitute or prostitution, they don't do well at all when it comes to that aspect of life. Number two, you have hebephrenic schizophrenia. This is also a major feature where patients always found themselves in public places. What are the public places you find them? You find marketplaces, post office, and gutters. See them picking things from gutters. The next type, we have catatonic schizophrenia. Here they have two phases. Number one phase, you have excitement phase, where the patient is always very aggressive and maybe physically and verbally overactive and wandering tendency, going from one end to another. Number two phase, we have stuporous phase. Patient will manifest signs and symptoms almost like depression. They are withdrawn and also looking very weak always. So that's why they have told you that they have two phases. One excitement phase and the other side is a depressive phase. Then the third type, we have paranoid schiz. Excuse me. Paranoid schizophrenia. Here the major factor is a paranoid delusion, attributing his illness to a particular person and also hold to that belief, so that each time he sees that person, he says, "You are the cause of my illness," and try to cause harm. They are under paranoid, always paranoid, thinking that this person is the cause of his illness. So the number 5 type, we have undifferentiated schiz. Here, there is no specific feature to classify the patients because the signs and symptoms are mixed up. Today he's showing that he's depressed. Next tomorrow he's showing the face of hebephrenic. The other time we showed the face of catatonic, just like that. You cannot actually define them or know exactly which phase they are. That is schizophrenia on that type. So we have mentioned 5 types. Simple schizophrenia, simplex. We have hebephrenic schizophrenia. We have catatonic schizophrenia, paranoid schizophrenia, and undifferentiated schizophrenia. What are the general signs and symptoms? Number 1, we have disorders of perception. You know, when you go to my other note, we have described what perception is. So disorders of perception. We have illusion. We also have hallucination, auditory, and somatic, always feeling that things are crawling on his skin. And he's always feeling that people are talking to him while others are actually not seeing what they are saying. So we go on to talk about disorders of thought. under signs and symptoms. Number 1, under disorders of thought, we have delusion. Delusion of persecution. They also believe that others are hostile or trying to harm the individual, always accusing people of wanting to do one thing or the other to them. And if you see a person or individual behaving that way, you should know that there's something wrong with his upstairs. You can ask the patient or the individual to go to hospital for checkup. Number 2, we have delusion of reference. Always having false belief that the public or the people are directly related to the individual. Always having false belief. Under disorder, number C, we have somatic delusion. He believes that nobody. Also believe that one's body is altered from normal structure or function. That is his own belief, pertaining to somatic delusion. We also have thought brokers. We'll be mentioning thought brokers, which is not new to you. They also believe that one's unspoken thought can be heard. What you have not said to another person, they believe that can be heard. Whatever he's saying can be heard by another person. See what mental illness can do? Always thinking upside down. The next one here we have delusion of control. Believe that one's action or thoughts are controlled. Hello everyone. This is mental health class, and we are going to deal with dementia. Dementia can be defined as a progressive, irreversible diseases due to degeneration of the brain cells. It is a chronic organic brain syndrome with intellectual impairment. Under it, we have signs and symptoms that you could also believe that this person have dementia. Number 1, we have loss of memory, we have judgment, we have disorientation of place, time, and person, we have emotional changes, and also physical changes, and changes in personality. Furthermore, we have types. There are 2 types. We have presenile and senile dementia. And presenile dementia causes, it is hereditary. Some will tell you it is unknown. Others will also tell you it's a trauma. Example, head injury maybe during delivery. The child might have injury without the mother knowing. Might also have fatal accidents, whereby the patient might tend to hit the skull, and without check, something terrible might happen, which may result into that person having dementia. We also have causes like hypertension, hypertensive, encephalopathy, intracranial hemorrhage, cerebral thrombosis. These are some of the causes that might affect, and then the person having pre-senile dementia. We also have infection. Example, we have syphilis, meningitis, encephalitis, cerebral malaria, which I have mentioned earlier, typhoid fever, and septicemia. So some of these infections, when you have them, you try to visit the hospital so that the treatment could be commenced. You also have other factors like neoplasm, Example of it, we have brain tumor. We also have drugs. Example, we have alcohol, Indian hemp, and the rest of others. And there are also people who are under drug withdrawal. Example, barbiturates, that can also lead one to having personal dementia. Another factor might be deficiency of vitamin B group. That might also cause personal dementia. Also have anemia. Those who suffer from anemia, we have different types of anemia, iron deficiency anemia, and the rest could cause personal dementia. We have metabolic disorders that might come as a result of diabetes, hypoglycemia, and the rest. Endocrine disorders also affect one having personal dementia. And that will lead us to clinical manifestation. What will be the clinical manifestation of dementia? The clinical manifestation varies according to the nature of the underlying pathological condition. Number one, we have age of onset. Number two, we have previous pregnancy or previous personality. Number two, we have rate of progress of condition. Another one, we have where the lesion is localized. Where the lesion is localized, especially when you have a road traffic accident or a scar in the skull, where that lesion is localized, that is when you have a problem. It may also manifest as follows: loss of memory to recent events and later on remote events. There are so many signs and symptoms which, if we want to discuss them today, we might not make the headway. But let me just take few. I have just mentioned one. Number two, we have reduced attention span. Patient will have reduced attention span, judgment, and concentration. We also have forgetfulness. Patient tends to forget names of people and also familiar objects. Also have inability to calculate in case of shopping. You might not know how to calculate. Maybe when he goes to shop, you find people who don't have conscience might try to cheat them. So you have changes also in behavior. Mood also swing. Today is happy, next tomorrow he is not happy. Also have disorientation in time, persons, and also place. We have neglect of personal hygiene. The person don't tend to bath, don't tend to dress well, always, getting angry with anybody he meets. You have deprived food habits, inability to eat properly. He doesn't want to eat, he does not like to eat, and he can also eat like a baby, throwing food on his clothes, and when you ask him to know what he's doing, he gets angry. Disorders of thinking, he doesn't think straight, shows a rambling speech, which could be incoherent and also repetitive. You can repeat one thing 10 times, and you should know that there's something wrong with that. He also has delusion of persecution, always suspicious of people wanting to kill him or people poisoning his food. Under physical changes, what do we have here? We have loss of sight, hard, heavy, weak limbs. There's always weak limbs, incontinence of urine and feces, especially if he doesn't have anybody at home. Some of these symptoms might come, try to have some of these symptoms. So he needs somebody at home so that when these conditions continue or is there, you'll be able to help him out. The next one, you will have hallucination and delusion. That is misinterpretation of the actual stimuli. He's always confused and always having wandering tendency, and plus you will have insomnia, inability to sleep. Management. What is the management of the patient with personal dementia? A patient is better nursed and managed at home. Most people will tell you it's not a psychiatric illness. Most people also will tell you it's an old people sickness, whereby it is a natural phenomenon for one to, when you are old and you now start having such symptoms. But this one we are looking at pre-senile, coming earlier than now 35 years, which is abnormal. So the patient needs to be treated well so that he can gradually get old, not forcefully getting old. So management is better nursed and managed at home. We also have medical management. What are the medical management? Say treat the treatable causes. Those causes that are treatable, you treat them based on the causes. And also palliative treatment is also carried out symptomatically. Yes, those who present with hypertension, symptoms of hypertension, we treat them based on that. Those who present symptoms of diabetes, we treat them based on what we have seen. So drug of choice, what is the drugs that they use? We have antipsychotic drug like Lagatil, which is a drug of choice. We have haloperidol, could also be prescribed. We have anxiolytic drugs like Librium, Valium are also useful, which can be given 5 to 10 milligrams if necessary. We also have other supportive drugs like vitamin B1 and vitamin B12, iron and vitamin that will also support their health. The last one, we have antibiotics where necessary as prescribed by the doctor. So the next one we want to look at is nursing management. In anything we do as nurses, we need to bring out those things that can do best to our patient, apart from maybe a doctor's prescription, because that is their duty. Our own is to carry out our nursing responsibility. Patient is admitted in a separate room with familiar nurses in the attendance, because this person is having disorientation of place person. So you need to nurse him in a separate room, of which he is familiar with those things that he can lay her hands with. So who could okay, the next one here we have, this could also build up trust. Whatever you're doing to build up trust and confidence between the nurse and the patient, and also reduce confusion. We also have your relations and friends should be encouraged to visit the patient. Because most people, when they have patient who has a dementia, proper dementia or pre-senile dementia, they tend to abandon the patient in the hospital, leaving the patient for the nurse to carry out. But that should not be the case. We should also try to encourage our relatives to always take care of their patients. The nurse explains every procedure and what routine to allow for cooperation. So you need to explain each and every procedure you want to carry out, so that the patient can always cooperate with you. The patient's belongings are kept at also a familiar places. You don't need to scatter this person's belongings. You need to keep them where she's familiar to pick them at any point in time. Patient telling the patient, keep telling the patient time of the day, because sometimes they don't know how to read. They might read and sometimes they are confused what the day looks like. So keep telling them, reminding them, now it is 12 o'clock, now it is 6 o'clock, now it is 9. With that, you are trying to, create rapport with your patient. Keep calendar and also clock in a strategic place. to assist patient in orientation. The clock there should be able to teach your patient how to read his clock to know time and place. Encourage personal hygiene and supervise and assist where necessary. Encourage the patient to always bath where it is necessary. Then give balanced diet and fluid. Bowel and bladder control feeding also is very important. That will help the patient control his bladder and how he can urinate each time. Carry out general observation of the patient. Yes, general observation of the patient is also very important as far as psychiatry is concerned. Observation will help you know when the patient is actually coping and when he is not coping. Observe patient movement to protect him from dangers due to wandering tendency. Already the patient is confused and he has this wandering tendency. He can move from end to end. So what you do as a nurse who is on duty, you need to observe what the patient is doing each time. So, encourage good night sleep using necessary nursing measures. Encourage good night sleep. And what are the measures you are supposed to carry? So, carry out family therapy. You call in their family to always talk to the patient, encourage the patient by telling her that she will come out from what she's suffering from. Supportive psychotherapy is also necessary here. Occupational therapy is necessary. Recreational therapy is necessary. And also rehabilitative and spiritual care is also necessary, because we cannot do without our God or missionary our God. So sometimes you call in their spiritual father to come and pray with them. With that, you'll be happy that yes, they are in good hands that will see them through. And that has brought us to the end of dementia. So if you have your questions, try to ask, comment, and tell me what you think about dementia, how you can nurse your patient. The next topic we are going to talk about would have been anxiety, but my colleague will treat that. So let's go over to the next